let's say you're going to change out a tracheostomy tube, and you were afraid that the two holes, the opening in the skin and the opening in the trachea, actually wouldn't line back up. One thing you can do is you can take a suction catheter, pull or cut the suction port off of it, and you can utilize this as a guide wire if you would. So if I was going to change this tracheostomy tube out and I was afraid I couldn't get another one back in, or I wanted to make sure those two holes lined up the same, then what I could do is pull this through, take your inner cannula out with a sterile glove, advance your catheter down the tracheostomy tube until you meet resistance, and then that essentially leave that in place while you pull your catheter out, while you pull your tracheostomy tube out over the catheter. That leaves leaves you a conduit, if you will, back to the trachea. So then you can take your new tracheostomy tube and slide it over, and then back into place. Pull that out and secure your tracheostomy tube with attached tracheostomy ties. And, be proud of the work that you do. Make sure that your patient's looking nice and pretty, if you will, when you're done with it. And then again, your new disposable inner cannula, place that into place, and then return your patient back to oxygen therapy if they did that. And always after you do something with, whether it's changing out the posy tracheostomy ties, if you've changed out a tracheostomy tube, always assess for breath sounds afterward. Look at the heart rate, SpO2, blood pressure, assess breath sounds, because it is possible that you could put the tracheostomy tube into a false track, and then especially if you hook them up to a ventilator or something, you would see the onset or the development of some subcutaneous emphysema. So make sure that you're paying attention to that. So that's it for this video.